All right. So now let's look, first of all, the current challenge for private practice physical therapy. Everybody talked about profit margins that are declining. And I am sorry to show you some actual national numbers, national statistics. And this is from the PPSA KPI benchmark study that shows the profitability, the profit margin for physical therapy private practice. So here is what I'm going to show you. Well, first of all, on the average, practices do 12.9 visits for every new patient they see. They give them 3.6 procedures per visit. And if you take this across the whole United States, they make $120 per hour. Now, I know you will tell me, oh, no way I'm making 120. No, but in this study, there were practices that participated from Alaska and from Washington State and from states that they pay a lot more money that potentially you are making. But at the end of the day, the revenue per visit was $104 average, and the net income was only 8.1%. The median net, meaning profit, this is profit, right? This is net income, this is profit. That is not just income. This is net income. This is actual profit. All right. So in the PPSA study, the net income, the net profit was only 8.1%. Now, what is worrisome that I'm going to show you right now is this. What is worrisome is the trend. Again, this benchmark study of PPSA it started in 2016 and it ran 2017, 18, 19. In 2020, it did not. And then it was run again in 2022. The new study for 2023 numbers is starting in the next few weeks, actually, the collection of outcomes. So, but look at this. The profit margins back in 2016, they were close to 14%, 13.6%. And look where they are right now, 7.2%. So we have a declining trend of the median of the net income. All right, this is very worrisome. This is problematic. Now, why the net income so low? We talked about this a little while ago. Reimbursements are going down. So you have declining reimbursements, right? And what happens to your expenses? Are your expenses declining along the same way as reimbursements are declining? No, your expenses are going up because what you pay for salaries for the staff is going up, and what you pay for rent, for supplies, for anything else is going up because because inflation has increased. You have this. Let me draw this. Okay. So if I take 1 second, I'm going to use a white. So you have reimbursements that are on a decline, and you have expenses that are on an incline. So what happens here? This is your profit. You had this much profit, and now your profit is down. So this is where you have to say, okay, what am I going to do to increase my revenue so that my profit margin can increase? Because I'm telling you, it is so much easier to increase revenue than to cut expenses. You can cut expenses, but it is so much more challenging to cut expenses than to increase revenue.